Okay, good. Hello, it's Angelica at the Osteopathy and Healing Center. Yeah, that's me. And we're going to basically do a demonstration of what osteopathic manual therapy treatment might look like for lower limb dysfunctions. So basically I'm just going to go on to the sacrum and I'm going to go onto the lumbar spine, and I am checking for the cranial rhythmic impulse of the sacrum moving into its flexion nutation phase and then into its extension counter nutation phase. And my fingers are on L5, 4, 3, 2, and I'm checking also for the cranial rhythmic impulse movement of the spine into flexion as the sacrum moves into flexion and into extension.
There's nothing.
You're being videotaped. Okay, so we're assessing the lumbar sacral area and we're checking if there's any compaction that we might feel here, and we're releasing that. So the second thing, we're going to check that iliac bone if it's moving nicely. Again, in its cranial rhythmic impulse, internally rotating flexion, externally rotating and extension. And it's moving nicely. So we want to just check the hip on the other side. So Omar, can you face the other side for me? And you're going to go on your side, yeah? So, like this. Very good. So again, I'm just checking that iliac, if it's moving nicely. The cranial rhythmic impulse. And if it's not, because on this side, the right side, I'm feeling like it's internally rotating and going into flexion more, you can go into ease, or you can go directly into bind, or you could start off going into ease first. You'll feel some release, and then you can go into bind. And then you'll feel underneath your hands things releasing. Feel those tissues releasing. And that's what I'm feeling. Now, just so that you can see if there's any femoral anteversion, you can ask the kid to sit with their legs crossed and in a W position and see which one's more comfortable. So can you sit up for me? And sit with your legs crossed, like this. And he has no problems. Looks like it's good. There's no problems with him doing that. And then, can you bring your legs to the side, like sitting in a W? So bend your knee. Bend your knee. No, this way. No, like this. Okay, and he's also wearing jeans, but basically you would have them do that with both legs and see if they like to sit in a W, and that would tell you if they're favoring the femoral anteversion. Okay, now I'm going to get you on your back again. So lay down on your back. Okay, and now we're going to assess, yeah, good, like this. If we've got that femur that's moving into internal rotation or medially and laterally. Okay, so we can check anatomically. I just have one hand on the bottom here above the knee and one hand on the hip. I'm checking for internal or medial and external rotation. And that looks really good. And same with the other side. Okay, and on the other side, I'd say when I'm turning the limb inward medially, there's some restriction. So we'll just keep that in mind so that when we get to the part of treating, we would treat that. And another way, you just bring your hands on the femur, checking for internal medial and external rotation. Yep, so there's some restriction there on the left limb with the femur when I bring it medially. So that's assessing that. Then the next thing we want to check is the tibia, which is below the knee. And again, you're just checking here. You're holding the proximal end of the tibia and the distal end. And you're checking for that range of motion of medial rotation and external rotation. And that's okay. And the other side is okay as well. So we're just assessing here, checking and feeling for things. Now the next technique is we want to check the fibula, which is the bone on the outside. So you can stay laying on your back. Okay. So that way you can see me when I'm on the fibula, and I'm just assessing. Almost done. We're assessing the fibula if it's moving in all of its directions. So I'm just moving it up and down, and I feel some restriction. I'm checking its seesaw movements. I'm feeling restriction at the distal end. And also check for the cranial rhythmic impulse of it moving like in a figure 8. And I feel here there's restriction. Don't forget to check the other side. Fibula moving up, down, like a seesaw and figure 8. And this side here feels okay, but the fibula on this side, it feels like there's restriction, and also the femur when I bring it medially. Then the last thing we want to check is the foot, if there's any metatarsal adductus. I'm going to just go on the lateral medial malleolus and the metatarsals, and I'm just going to check any restriction in relation to the cuboid, to the talus, and to the calcaneus. And again, we're feeling for any restriction. And it does feel there like there's restriction when I check the cuboid, and I'm going to just compare that to this side. So again, I'm just checking for restriction in relation to the cuboid, in relation to the talus, and in relation to the calcaneus. And when I check in relation to the talus, it does feel like there's restriction on the outer side here. Okay, so we're seeing things occurring here in the lower limb on the left side that could be released: femur, fibula, and talus. Okay, so that's just the general assessment, and we did do a little bit of treatment with the first two protocols on the sacrum and lumbar spine, because you also want to address that when you're having lower limb dysfunctions or any orthopedic issues in the lower limb. And then we also treated the hips, the iliacs, because again, whole body's a unit of function. We need to address the hips, the lower back, all the way down.